Hi, Dr. Ruslan.
Hey, Abby.
How are you?
I'm great. How are you doing?
I'm great. I'm so happy you're here. You
Well,
are a different kind of guest than I've had before, so I have lots of good questions for you.
I'm ready, and thank you for having me on the show.
So, from the minimal research I've been able to do in the short time we've put this together, which I'm really happy that I got to do some, I think that plastic surgery has kind of always been your thing. You've always wanted to do it. So tell me how you ended up sort of down this road, and you're in Florida. So was Florida part of that vision for you?
Not at the beginning. It started off as medicine. It's something that I kind of grew an interest in high school. I was in the EMT. I thought, wow, this is really great. Something that I found interesting, something that I was good at because naturally I was good at the sciences, was really interested in the mathematics. And it was around in college, I had this opportunity to do a preceptorship, and I was one of the few chosen from the pre-med program. We went out to Hershey. I got to actually follow various doctors and I thought, wow, this is really amazing. At that point, I started shifting more to surgery. Surgery just seemed to fit in what I love. I loved medicine, I loved the whole concept. But throughout my whole life, I loved crafting and art and architecture and engineering. Those have all kind of they seem like really separate things, but believe it or not, they all come together in surgery. It's the art, it's the craft, engineering, architecture, and the science of it. And where I really found that they merged was surgery, especially plastic surgery. And that's where I did get to follow a plastic surgeon around there. I'm like, this is really great. This is surgery, which I love, but it also allows me to add that architecture, engineering, and just kind of creativity. So that's where it really kind of
Love
started to
that.
kick off. Yeah. And around that time, there was a famous show, Nip Tuck. And I thought that was just
Yes.
fascinating. Really, completely fictional, way out there, not how it is, but very entertaining.
Right.
And so I thought, yeah, this is really great. So in med school, I always like to do my due diligence. I joined a lot of clubs. I was treasurer of this, president of that, vice president of this, all surgical. I explored orthopedics, general surgery, cardiothoracic surgery, and still, out of everything, it really came back to plastic surgery. But the one thing I learned there, I never knew about being able to specialize in just facial plastic surgery. That was the thing I actually learned around my second year of med school. I thought this is great. I love plastic surgery. I love the detail. And now learning about the face, the structures, so detailed, so minor, but have such a big impact. And that's really where I fell in love with it. And, the rest, as they say, is history.
I feel like that the stakes are so high in facial plastic
Mhm.
surgery. I mean, I suppose they're high in any plastic surgery, but that's like, it feels like a big responsibility to take on. How do people, like when you meet with people in consults, do they ask you about that? Does it feel like do you feel you have to go out of your way to let them know they're in good hands because the stakes are so high?
Yeah, that's a great question. The stakes are high, and I always say that. And one thing I always say to all my patients is I really appreciate the opportunity when they choose me for their surgery. I take that very seriously. It's not just, oh, I'm just trying to get these patients to, book with me. No. Yes, this is a business, but this is also a responsibility. So when they hand over that control to me and they truly trust me, especially with their face. Like you said, something you can't hide. You can hide a stomach, a breast, a butt. You can throw some clothing on it, not go to the beach. You cannot hide your face. You can't walk around wearing a mask, unless
Right.
it's COVID times. So definitely a big responsibility. Millimeters, centimeters really matter. So I don't really tell patients that they have to trust me or anything. I treat the consultation process by explaining things to them. I treat it the way that I would want to be treated. I tell them what I think they need to know. I give them a very honest assessment. Sometimes that assessment is, I'm sorry, like you don't really need what I have to offer, or your expectations of what surgery can do and what we can really do, not realistic. There's so many ways that this goes. So I try to give them just the most honest and most in-depth kind of analysis and my opinion. And if they choose to go with me, that's great. Then I really, again, I appreciate that opportunity.
Do you feel like right now there are a lot of trends, or do people come in with a photo or a picture of something and say, make me look like this? Because I feel like I will tell you, I had a nose job when I was 21 years old. I brought a picture of what I wanted. My doctor did a great job, but it's nothing like the picture that I brought in. And now looking back, I'm like, of course, like that's so much pressure. You can't guarantee that it's going to look. He's like, I do my job, and if my job's well done, it's going to be a good nose job. I can't guarantee you're going to look like this picture. So I think now, I mean, I feel like people are like, I want to look like this. What do they bring pictures to you? Do they show you things on Instagram? How is it working?
Oh, absolutely.
Wow.
So this whole bringing in a picture, people love that, and some will come back. But let me show you. But let me show you, and they'll even show me my own noses, and I go back to the same thing all the time.
Yeah.
Uh, it's a little bit of a gimmick to bring in a picture of a celebrity nose or someone else's nose. It might communicate a little bit of what they have in their mind, but I make it very clear you cannot have somebody else's nose, nor do you want somebody else's nose. So for like rhinoplasty, one thing that I do is I make sure that I go through their pictures. We take photos here, we do computer morphing software, and I show them what their nose looks like on their face. And I always say with rhinoplasty, to have a good rhinoplasty, one of the key aspects is to understand the illusions. So sometimes they think it's just to reduce the nose here or turn it up, turn it down, and it's not. And I show them this. I'm like, look, in your case, if we reduce this, look how weird this looks. So we also need to reduce this error. It's much easier to explain when I show a picture, but there are many of these illusions, and this is why some people end up with noses that just completely don't fit their face. So we sit there, we go through the pictures. I call it a collaborative process because first they tell me what they think they want. Then I take the picture, I show them what I think they meant along with some of my recommendations. Then they tell me sometimes it's yes, that's it. Or they tell me, well, no, I imagined something maybe a little bit different. So we collaborate with what they want and what I know to be possible and within the range of what would fit their face.
God, the AI or like computer element of it is so different because mine was done so long ago. I would have loved to be able to see what it was going to really look like. I think now you probably can show, well, if we do this, it'll look like this. And if we do that, it'll look like that.
Right.
How has that
And it
changed
is an
since you
important, yeah.
started? Sorry, go
Oh,
ahead.
it hasn't. Yeah. So
Yeah.
I've always done this.
Hmm.
Luckily, I've been in the generation. Computer morphing software has always been around. I did adapt to it very early on, but when I was starting, it was actually not that popular. And a lot of surgeons still don't do it. I think it's essential. It's absolutely essential for that communication. Not that we can get exactly.
Right.
We get into what I always say, we get the essence of the nose. We can't get it to the exact millimeter or the exact rotation. But as long as it has, and I'm very proud to say I get well within that ballpark, sometimes it even looks better because the lighting is a lot more natural with
Yeah.
what is true to real life. It really is incredible. But now you mentioned just generally bringing in pictures. The
Yeah.
nose is specific to everyone's face. I think it actually gets worse when they bring in pictures for other procedures like facelifts, brow lifts, and all this because that's totally different. You can't just get somebody else's result. There are so many other factors, and the best way to do it is to actually look at their own face. And these pictures, like the morphing that I'm talking about, you can't really do that too well with other procedures.
Hmm.
You can try. It's not that good. The best way is actually to use your fingers and move areas around. Even
I
when I
can't
do
help
these
but want to do it
consults.
now that I'm watching you do it.
Oh, everybody does. Oh,
Yeah.
I see this
Yeah.
20
Like
times a
all the time.
day.
Yeah.
So something like this. It's
Hmm.
so funny, but yeah,
Yeah.
yeah, it's the natural thing to do. But it really is the best way. When you're in the office, I'm able to show them in the mirror. When we do this virtually, I usually tell them and instruct them, okay, put two fingers right here and pull up at this angle. That's approximately what you can expect.
Wow, that's awesome. I feel like it's very empowering,
Yeah,
you know?
it's something that allows them to see what the result is. And it's a good measure of how they're going to feel about the results. So another thing that comes up, people come in wanting, let's say a facelift, and you can have two people, identical faces, just the same person with the same amount of laxity. And one person, you do this and they look in the mirror and they go, okay, yeah, sure. Well, if that's their reaction to it, then no, you don't want to go through a whole facelift just for meh results.
Yeah.
Man, it's not for you. Another person comes in, you do this, and they light up. You
Yeah.
see that reaction in their eyes. They go, oh, yes, yes, this is it. This is what I want. Then 100% worth it. And
Mm.
that's where the objective meets the subjective. And that's one of the ways that I measure if somebody is a good candidate for it.
So what are the other ways you measure? Are there times where you really feel maybe even psychologically like it's not going to be a good decision for this person?
Yeah, well, so the way that we do this, and I look for their reaction to see if it's going to be worth it. That's probably one of the biggest. Of course, if they're doing this and nothing is moving, like I'm sorry, I can't, in good conscience, take you on for this.
Right.
Um, and with that, I'll also add, it's not an age thing because we actually now get people in their 30s who come in for facelifts.
Hmm.
But if you do this and there's a legitimate amount of laxity, and when you see the improvement, they have that aha wow movement, great, they're a candidate. Some come in their 50s and they're barely moving anything, then no,
Hmm.
you're not a candidate. Other ways, yeah, it just depends on what they want to achieve with it, where they think that one surgery is going to just change everything. So they do have to be mentally prepared. They always ask about the recovery. The recovery is not as bad as most people think, but it's a recovery process. It's an investment. It's a financial investment, but it's also a recovery investment. No, you can't go straight back to working out. I had someone who wanted to go jet skiing and kiteboarding just 2, 3 weeks after a facelift. And I'm like, I'm sorry, no, it's
Mm.
not a good idea.
Yeah.
And at 2 to 3 weeks, it's great. It's actually a compliment because at 2 to 3 weeks, she felt good enough to do it. She felt she looked great. She felt healthy enough. But at that point, you don't want to just suddenly turn your head, loosen a stitch, tear something. So it's an investment. If they are willing to put in the time, the recovery time, mostly 1 to 2 weeks, and then with certain restrictions going on, and the product that I can produce objectively meets their expectations, great. I'm happy to do it.
What do you think? I guess as a somebody who's a patient, what do you think are the important questions to ask a facial plastic surgeon when you're having a consult? How can you decide who the best one is for you?
Oh, wow. How many hours do we have? I've thought about this a lot. So if you've seen any of my videos, I really try to give patients information because so I do a lot of revisions and I always try to ask them and figure out where it is that they went wrong.
Mm,
And if I really had to narrow it down, information is probably the most important thing. But we live in a world of too much information and
right.
misleading information. A lot of it is for marketing purposes, unfortunately.
Hmm.
So you're going to get the good and the bad, but my advice is take it all in, listen to it. Don't think that any of it is gospel. Get all the information, but then go to actual consultations. Not one, not two, maybe 3 or 4 consultations with good, legitimate surgeons. And then ask them about the procedure, ask them what it is they recommend, but also ask them why. I do this for all my patients. I explain to them why I'm recommending this, the science, the architecture of the face behind it, why we're suggesting this, so they can understand the reasoning. Then, if you do that with, say like 3 surgeons, you can compare their reasoning and then decide which one makes the most sense or see which one is the more consistent recommendation.
Yeah, I think also, I mean, personality just is part of the equation, right? You just vibe with somebody. Like I think about
Yeah.
because I've worked with so many people who work with therapists. Like you know when you're with a great therapist, when you're that person can just get you. And I think if I were gonna let anyone touch my face at this point, I would need like that good vibe, you know?
Yeah.
Um, what was I gonna say? Oh, in terms of like studying, because this is where sometimes I think there are people who care significantly about what the diploma says behind you on the
Mm.
wall, and some that don't think it's as important. Within the facial plastics world, obviously you're well studied. Like, do you feel like those diplomas mean everything? Do you feel like people are getting away with things who maybe aren't as credentialed as they should be?
Ooh,
Which I
spicy
hope they're
question.
not, but
Yeah.
yeah.
it's a spicy question, and I always try not to offend anybody. But one thing that I've seen in doing revisions is the revisions that I do come from all different states, all different countries, and all different Ivy League, mid league, all sorts of places. So I haven't found that to matter as much. I think the things that really matter, and you have to go back to how it is that we learn to do what we do, is good background. A good foundation is important, but it's not everything. It's like saying you went to high school and based on your high school education, you know how to navigate life. No, we get a lot of training in med school. We get more specified training in our residencies and fellowships. That training really does set us up, but it's what you do after. So if you continue to learn to improve and also you are willing to do the right thing for each patient. So with plastic surgery, you can do quick shortcut techniques. You could do ones that maybe are a little bit more involved, or you could say, I want to get the absolute best result for every patient. So I'm going to make sure that I'm always at the top of my game. I'm always up on, latest, and we could talk about trends and latest. It's not always the
I'd love to talk
greatest,
about that.
but
Yes.
yeah, but we could talk about that in a bit. But really, it's about understanding the right thing to do for each patient, but also be willing to put in the effort. A lot of the procedures that I do take longer because I really want to do the thing that's going to be more effort, take more time, but it's going to give a better result. So I think to answer in a nutshell, no, I don't think that it really matters. It matters on the individual surgeon. Yes, they have to have the innate ability, they have to have developed that innate ability, but they also have to exercise that innate ability, the acquired knowledge and skills, and be able to put in the effort. So all three really matter.
Mm. I'm thinking about right when you graduate and you start like working on someone's face, do they know that it's maybe the first face you're doing? How do you even like foray into this when you're first starting out?
Everyone's got to start somewhere, right?
Yeah.
So, yeah, I think I know. I mean, you have to be honest with patients. When you start out, you're new, you find those patients that are willing to trust you just based on, how you're talking to them. And when we're starting out, we're not exactly starting from scratch. Like I
Right.
said, we do get a lot of training. There's medical school, which gives you a broad training in medicine in general, and then residency. That's 5 years. It's not
Yeah.
like 1 year, it's not a weekend course. It's 5 years where you're progressively learning more and more under somebody else. By the time you're in your fourth, fifth years, most of us at our chief resident years are doing a lot of things and we have a lot of responsibility on our own.
And in your particular office, or I guess in your training, was there any like emergency room plastics? Is there like from accidents, right? Versus now, I assume the majority of the people that come to you, it's elective surgery.
Correct. Yeah, in fact, yes. So in our residency, we covered a few different hospitals, and we would be the ones called in when there were facial lacerations, accidents, a lot of dog bites. And as residents, you never want to call your attending in unless you really have to. You try to get everything done properly, but without having to call them in. If you go to the OR, you have to call them in. So we would repair a lot of very serious lacerations in the emergency room, middle of the night, one hospital to another. And that's where I did a lot of these awake procedures. That's something that really inspired me to do more and more awake procedures because if you can repair, a lip that's hanging off on a little kid or a nose that, not to be too graphic,
Yeah, no, it's
but some
important.
of these serious things, if you can
Yeah.
repair them in the ER with just minimal relaxation in the ER setting, you could do a whole lot. So that's where I actually started doing a lot of these awake, especially awake rhinoplasties, which people still, surgeons come up to me at conferences all the time. I don't know, how do you do that? Like, I don't know. It's not magic. I'm like, I'll teach you. And I do teach
Wow.
them. Like, oh, I don't know. I don't know about that. It's actually pretty straightforward, I think. Patients love it.
Hmm.
They start off with, I'm very nervous. Everyone tells me that I'm crazy for doing this. And afterwards, I can't believe I just did this. That was so much easier than I thought.
Yeah.
Still takes the right personality, but I find that about 90% of people are the right personality.
Yeah.
But yeah.
Are there things you're noticing also about like, what are people coming in with a lot right now? Maybe, or what waves do things go in? Like, everyone wanted a boob job once. Now they all want their eyebrows done. Are there things that people are coming in for more and more?
Facelifts are definitely on the rise. It used to be that facelifts were only when you got really old, really
Yeah.
saggy. So I have a theory on this. And it's also why we're seeing a lot of younger patients, even in their 30s and 40s, coming in for facelifts. Before, the lifts that we had, your typical smash lifts, you would see them, they would lead to certain appearances that are very the classic facelift appearance, a little bit windswept, a little bit too tight.
Hmm.
That's not from doing too much. That's from a slightly inferior procedure. However, when you have a lot of laxity and you get to a certain point, 60s, 70s, you'll say that looks better than what I look now. So I'll take the overpulled, overstretched, classic facelift look over looking so bad. Now, with the deep plane facelift, which has become more and more popular, and we actually have a course teaching a lot of other surgeons how to do it. So more surgeons are learning how to do this. And it's just such a better procedure. You get much better and more natural results. So now that, let's say, that 40, 45-year-old who thought, well, it's just a little laxity here, but wow, this really makes me happy, but I don't want to look over pulled, not at 40, 45. Now they're seeing, well, I don't have to look like this. I can look more refreshed while still maintaining a really nice natural look. So that's a big trend. So now we're just seeing more and more patients, younger patients, who want that really nice refreshed facelift look because it's not a facelift look. It's just a facelift to look younger and more
Refreshed.
refreshed.
What's that one called?
Yeah. The deep plane
As
lift.
I'm like furiously
Yeah,
writing it down. Okay, so
yeah,
the deep plane, and then let's say in 10 years it starts sagging again. Is there any harm in in having to do it again? Is this getting because people are
yeah.
doing it younger, does that make it less likely they'll have to or they'll be able to do it again later if they need to?
Great question. Actually, a question I answered earlier today for someone that made a comment. No, if it's done properly, 10 years, because like you said, it has nothing to do with the facelift failing. It falls, we lift it, and it's going to continue to fall because
Right.
gravity is still there. So 10 years, maybe 15 years down the line, we can definitely do another one. There's going to be a little bit of scar tissue, but any good surgeon can get through that scar tissue. Um, as long as in either case you can redo it, but I would say it should be done properly. Some of the revisions that we do are a little bit difficult because the prior surgeon maybe went in the wrong plane, they pulled the skin, they created really difficult like pixie ears where you see the ear really stretched out, a scar that's very long. Those things give us some challenges, but we could always find ways around those. So no, getting it earlier will not prevent you from getting another one 10 years later, maybe a third one, maybe a fourth one. So yeah.
Right. You're kind of just doing that research now. You'll do it as it, right? There aren't very many patients that have done three over the course of 30 years at this point because like you said, people would really old. They would do them when they're old. Like now that people are doing them 40, 45, we're going to start to see what it's like to keep doing them at 55, 65, you
Yeah.
know?
We've seen some. There have always been those people that have pushed the envelope and they love plastic surgery since the 80s and the 90s. And yeah, no, I have seen some of those.
Hmm.
We've done actually their third facelift.
Wow.
Yeah. So
Wow.
it's very interesting. Um, because you go in there, yes, there's scar tissue, but you still, as long as you know your planes, you know your layers, and you do good meticulous technique, then you're good. The thing actually that makes facelifts harder, not impossible, and this is the point of controversy, are all these other minor procedures.
That's what I was just going
So
to ask.
yeah, I don't know if I'm a magnet for it, but I tend to get these patients that have had permanent threads. A lot of these radio frequency and all these other heat type of devices. Sometimes it's fine, but a lot of times it causes a lot of scar tissue, a lot of tethering. So to understand that we have our skin layer, then we have a little bit of fat underneath the skin, and then we have this magical layer, SMAS, SMAS. That's actually what falls. And in the neck, it turns into a muscle. And that SMAS needs to be brought up. But all of these procedures, the threads, the radio frequency devices, they create tethering between those layers. And so as surgeons, when we go in and we try to get between those layers to pull them up, it's a little bit more difficult. And mind you, we're separating on top of nerves, on top of muscles, critical structures that we don't want to injure. So it makes it a little bit more challenging. Sometimes there's just you just have to go slower and more careful, and but it's not impossible. It's just more challenging.
And what are those like the red light masks that everyone's using? Please say no, because I
No,
feel
those
like
are
okay,
fine.
those
No,
are
those are
fine. Okay,
fine.
good, good, good.
No, I'm talking about the minimally invasive, but
Okay.
still somewhat invasive. I don't want to name particular things, but
Yeah,
things that really heat up the under layers of the
got
skin.
it.
They will take away fat from certain areas. They will create scar tissue. Uh, the threads, permanent threads are terrible.
Yeah.
I've had a lot of battles with those. They're difficult. So things
Okay.
like that.
Has there ever been a time where you've started on someone and like you've put them out and you have a plan and then you get in there and you're like, shit, we can't do this?
Not exactly, no.
Okay.
Usually patients are pretty forthcoming about what they've had, and I have a pretty good idea just based on the examination. But yeah, you sometimes get in there and you go, "Oh, okay." But no, you don't abandon it as long as you can continue safely. Let's see, I've seen, like I said, these permanent threads where they're actually intertwined with the nerve
Oh
that
my
controls your
God.
facial muscles, and you just have to I've taken an extra hour on each side of the face to separate it gently. Somebody with facial implants that were in the wrong layer, so you just carefully work around that. People with, and this one I'm really, really against, facial liposuction. I don't think there's any place for that. The face should not have liposuction because when you suck out that little tiny bit of fat, and when what people see here is not really the fat in the superficial layer, they damage that magical SMAS layer. And so sometimes you find holes in there, you find little herniations through it. You try to grab it and pull it up, and it doesn't quite work. There's irregularities. But no, you don't abandon it. You work through it. Surgery is problem solving. That's why it's plastic surgery. The whole idea
Hmm.
is that you have to be creative rather than just doing a standard procedure over and over again.
And are there any of these less invasive procedures that you see that you like? Like I'm thinking, I always see the ad for like the cool sculpting for like under your face or for your belly. Or how do you feel about like fillers or any of these gua sha tactics? Do you feel like in the long term they're actually helpful or not so much?
Well, let's start off with the least ones. The
Okay.
gua sha, there's no harm to it. You can move lymphatics, you can get more blood flow, and the same thing with the red light therapy, get more blood flow, healthier skin. Those are great. They're not causing any harm. So even if we can't prove that they help, they're not
They're not
causing
hurting.
harm. So that's totally fine. Filler got a very bad rep over the last few years. I kind of anticipated it. It's something I've always said. I think that filler is great.
Okay.
I've been using filler for many, many years with great success. I personally have never had one of these overfilled patients that have all this crazy migration that everyone's talking about because I've always used it relatively conservatively. Filler has a place in adding small bits of volume in specific areas tastefully. Somebody that wants to enhance cheek structure or jawline structure, great. You can do that tastefully. Someone who's had aging and you're actually replacing volume, not trying to solve a laxity problem. So we have three different things that happen. There's skin changes, there's volume changes, and there's laxity. Each one of them has a proper treatment. So if your face falls, you need to lift it. If you lose volume, you need to add volume, either with filler or fat. What has happened, and the reason that you ended up with all of these people with overfilled faces yelling filler is bad, is their face would fall and they say, I'm not ready for a facelift. Oh gosh, no. So they would go to any of these places that would not be completely ethical or scrupulous, say, hey, don't worry, we're just going to fill you up, and we're going to fill you up so much that you're going to get a lift. If you think about that concept, imagine buying a coat that's too big, and rather than going to a tailor and saying, hey, let me tailor this, I'm just going to gain 100 pounds until I fit into the coat and it's stretched. It's exactly that. So they would inflate their faces. There's no room for that. So yes, filler is great if it's used properly. if you assess the patient and you really see that they need it, I think it's wonderful. I do it all the time, but not for compensating for the wrong things. Next, so school cool sculpting, I think that's really kind of fallen off of the popularity list. I was never really in love with it. I never heard any amazing feedback about it. And some people got a little bit of improvement around the belly and certain other areas, and that's totally fine. I don't love things like, yeah, again, I don't want to name particular
I
names,
understand. Yeah.
but I don't love a lot of these because they, in one way or another, whether through ultrasound or radio frequency or through helium, they add heat to those deeper layers. Heat, sure, can lead to new collagen formation, a little bit of tightening, not what people think, but it also melts fat and it causes a lot of scar tissue. So, not my favorite stuff. I think that if you want a true improvement, you should do the right thing. And it also comes from the fact that I see a lot of these patients after they've gone and had this, that, the third thing, the fourth thing, and first, nothing is quite giving them the result they thought, maybe 10% here, 20% there. And in the end, they're chasing it. Then they end up, we have a nice case that we're going to do a video on. She did all of these procedures, ended up with a lot of loose skin down in this area. And they just kept throwing more and more minimally invasive procedures, whereas we should have just done the right
The
thing right
more
away.
invasive that would ultimately be kind of less is
Yes,
more sort of vibe.
correct. Yeah.
Um, okay, you have children, I believe, right?
Yeah.
Okay, if
Yeah.
your kid came to you and said, I want to do X plastic surgery, like what's the one that you would be like, absolutely not?
Ooh, probably facial liposuction. That's the one I'm very against. I don't
Okay.
see any way that it could be positive. Really, I've just seen too many issues, particularly like I said, irregularities and damage to the underlying structures. Everything else is fair game based on assessment. Because one person come to me, ask me for a lip lift, and I would say, no, I'm sorry, you don't meet the criteria. While your lip may be long and we can get an improvement, you have maybe too much tooth show, and we're going to create a negative that's not worth the positive. So it's really just based on the assessment of are they a candidate for it?
And do your kids ask you a lot of questions about plastic surgery?
They do. They actually, my daughter, who's the younger one, she's
Hmm.
6. She loves it. She calls herself Dr. Ruby.
Oh,
She
cute.
absolutely loves it. And every now and then, I'll do talks for like conferences and review surgical videos. She'll come up behind me, and she did this actually when she was 4. She came up behind me. She saw a surgical video. I closed my laptop right away, but she goes, "Oh, I like that." I'm like, I don't think I should be showing you this. She's like, "Oh, but I like it." So every now and then she tries to sneak in, and she's like, "Ooh, what is that?" And I don't know. Since then, she loves. I bring home like bandages and things like
Yeah,
that. All her dolls have injuries,
that's so
broken
cute.
arms, legs. So she's the one that really likes it. My son finds that it's interesting.
Hmm.
So
But
yeah,
he's not as engaged by it.
I don't think that's his cup of tea. He did tell me actually a few months ago. He's like, "Wow," because I he was asking me questions about it. I was doing my notes, and he just asked me a question, so I explained it to him. He goes, "Wow, you have a really cool job." Like, thank you, Mike. That
Nice.
means a lot. I appreciate that.
Totally. Take it while you can, because one day he'll be like,
Yeah.
it's so dumb what you do. Um, is there anything in terms of like what do you envision for the future of facial plastics that you're excited about or scared for?
So there's always a lot of stuff coming out. I've now been around long enough to see a lot of trends, and that's one thing I think we said we're going to touch up on. And
Yes.
trends aren't always great, and I
Right.
guess we'll get back to it. I think that we're getting into an area where we're getting better at just natural rejuvenation. I don't think that anytime soon we're going to have a good alternative to a good old quality lift because as things fall, logically, the only way is to lift it. I don't see any magical injection that's all of a sudden going to reverse things. But in terms of skin quality and just the quality of the tissues, it's still controversial, but things like exosomes so I don't know if you've heard much about them. These are little vesicles which we used to think were garbage put out from the cell. And now they found all of these important messengers in them that send signals to our cells to say, hey, rejuvenate,
Mm.
produce more collagen and more elastin. So these have been harvested over the last 20 years and harnessed, where right now they're not like FDA cleared for much, but people are using microneedling, getting them into the skin. I think as our research goes on, that PDRN, all of these rejuvenating and growth factors, we may get to a point where we really can inject our faces, our skin, maybe even something IV. I don't think that's anytime soon. We're talking
Mm.
about a few decades, where our cells can actually get younger, better, and return to a more youthful state.
Wow. Do you believe in that supplements can help with that in any way?
Some,
Yeah,
yes.
we don't have to go on like a whole tangent on that, but I'm just curious.
Yeah. Yeah.
Mm.
I personally take a lot of supplements
Mhm.
because I think that so our bodies are machines. We have to feed them. Every person is a little bit unique. Some people need more supplement, just genetically. Some need more supplementation in some areas, others in other areas. But to have good quality nutrition, a well-balanced diet should give you most of it, but you can supplement with certain things. I question supplements that are based on ingesting something like a large protein, like a large collagen, because if you think about how the body works, you eat it and nutrients, vitamins, the little proteins, these things do get absorbed, but most things get broken down in our stomach into their basic building blocks.
Mhm.
So, yeah, some things great, others a little bit questionable, but
Mhm.
we'll see what the evidence shows over time.
Yeah, I feel like one of the trends that I'm seeing, at least from the supplement side of things, is the cellular renewal. So I was curious when you were talking about cellular renewal, if we feel like
Mm.
internally that work can actually be done from food, vitamins, supplements, all those things.
Yeah, I think it's good to keep your body in a good, healthy state. Again, I think diet is very important. Exercise, get the body going, blood flow going, supplements. I am a fan
Hmm.
of those. Give your body all the essential nutrients that it needs. And I actually find that these are important pre and post surgery as well. Pre-surgery, you're optimizing your body. You're going to heal much better and faster if your body has everything that it needs. If it has all the supplies that it needs for healing, then you're just going to heal better. Um, we're also getting into the age of a lot of these injectable vitamins and things that people are doing. Um, I don't think there's a lot of strong proof, but it's in the works.
Hmm.
And that's probably around the corner. We'll know a lot more within the next decade.
Yeah, what supplements do you tell people to take for recovery? I remember when I had my nose done, I was taking extra vitamin C so I didn't get sick, and arnica pellets
Mhm.
for bruising. I'm trying to think of what the other ones are that are popular. What else do you tell people to take for healing?
Well, the two most popular things are arnica and bromelain.
Bromelain.
Arnica helps bruising, bromelain, which is found in pineapple, especially in the core, helps
Yes.
with swelling. So those, yeah, those are great. People always ask me, should I take them? Like, yeah, there isn't a lot of strong evidence to say definitively, but again, it's something that doesn't hurt. So I think, yes, I do think that it can help. I have seen patients who have had bruises and have taken certain supplements with that combination, and their bruising has gone away relatively faster than others. It's not exactly a double-blind study, so I can't tell you that there's strong
Yeah.
evidence, but anecdotally, I actually have seen them help. Zinc helps with your immune system. Vitamin C helps with the immune system. What we recommend here, because will start taking a lot of vitamins and they get very confused, some of them actually increase bleeding. So we want to avoid those, particularly
Hmm.
vitamin E and fish oil. People don't realize about those. And I looked for a very long time for a vitamin that didn't have vitamin E. Couldn't find it. I did find a supplement, and a brand that I've been very happy with is called Heal Fast. And I spoke to their CEO. They've organized it into a pre-surgical vitamin that does not have any of the
Oh,
bad stuff,
wow.
but has all the good stuff, as well as a post that has arnica, bromelain, and again, all the other vitamins. However, it neglects all the things that can increase bleeding or delay your recovery.
Interesting. That's very
Mhm.
smart. They should really feel like it's strange that that's not a bigger market out there because it should be.
Yeah. Well, actually, I found them because I was looking into, I got frustrated and I looked through all these different brands, and every time I'm looking, oh, great, nope, there it is.
Yeah.
And I was thinking of making my own vitamin because I'm like, I want to make this for my patients because I don't know what to tell them. And I stumbled across this brand. I'm like, this is pretty great. So I reached out, I spoke to the CEO. I'm like, all right, I like where you guys are at.
Good to know of. Good to know
Yeah.
of. Okay, let's just close up with a few like shorty questions. Like, what do you think is the most underrated procedure?
Ooh, probably a lip lift.
Ooh, a lip
It's
lift.
lip lift. I absolutely love lip lifts.
Okay.
So underrated. Very so a lip lift is an incision down underneath the nose, and we a lot of times we make a little incision here. If done properly, the incisions heal extremely well. It does four things. One is it shortens the philtrum. It lifts up the whole lip, so it improves the shape of it in a three-dimensional way, up this way, but also it brings out the inner lip, not the way that filler protrudes it forward, but in the pretty pouty way that you would see in, say, a 17-year-old. Just makes a beautiful but very natural lip, and which also gives it a little volume, and it gives you a little bit of tooth show. Just those little things. And sometimes these lip lifts are just 4 millimeters. We could do 3 millimeters, four, 5, 7, 8 millimeters, but you would be surprised what 4 millimeters on a lip lift can do. Nobody will notice, nobody will know that you had a lip lift, but they'll look at you and go, oh, you look so great. It's just it's one of those things that just really, really hits, and you go, what what is it? It's the lip lift. I call it the facelift for the center of the face.
Amazing. How much does a lip lift cost generally?
Ooh, that really varies.
Okay.
So yeah, it really varies.
Okay.
But like with us, it depends if you're doing corners or anything. So about like currently about 9,500.
Okay. I was going to say, are we talking 10,000 or 50,000? Like a 10,000 kind
Yeah,
of
yeah.
vibe. Okay. Is there anything you feel like people, obviously not your people, but other people waste money on?
Yeah, a lot of the, well, actually, that
Like
goes to the
those smaller
trends.
things you were saying.
Yeah.
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 Okay.
Sometimes a small thing is fine. Sometimes you come in, you just want a little cheek pop. Great. A little bit of filler is wonderful. Botox, all the toxins, those are great. I think that they really help if used properly. Sometimes they're overdoing them, especially in certain other areas. They're promising more than they can get, but great procedure. But if you are thinking about really improving this neckline and you have laxity, and they'll come in, they'll show you a facelift result and they'll ask for, either threads or some sort of radio frequency. I think that's usually a waste.
Hmm.
I will occasionally I have one of these devices that I've been using for a long time, but I'm very, very selective. I will do them on people that need a very, very small bit that I don't think are facelift candidates, but they want a little bit, so I can use it very conservatively to give them a tiny little bit of result for in the meantime without excessively reducing their fat or creating excessive scar tissue. As well as for those who say, no facelift for many years. So I choose them very, very carefully. I lay everything I told you, I tell them like it's called scar tissue. These are the risks, these are the benefits. And if still that's in line with what you want, then sure, I'm willing to do it. But I got to be honest, it's very, very rare that we come to that like perfect patient for it. They end up very happy,
Hmm.
but that's because we discussed everything and they're the right patient. Otherwise, it's just much better to do the right thing right away. And you would be surprised. The recovery is not that much longer, is
Hmm.
not that much worse.
Mm. I could keep going and going with 8 million
Mhm.
questions. So I promise I won't. But let me just ask this one. Are there people who come to you and they're like, I don't know what I need, but I need something? Or do you feel like most people come with an idea?
Oh yeah, we get both.
You get both.
But you're right. Some people come in and even when they schedule the appointment, like I don't know, just something. They usually say something along the lines of, I just feel I look tired. I don't feel tired. I look tired. Or they're like, just something happened over the last 2 years. I suddenly aged. And they're right. They don't know. They're not the expert. Some people come in and they think they know, and we kind of flip things around. And I tell them, well, actually, it's not that. It's this. And then they have this aha moment. It's my job to listen to them, to understand what bothers them, to assess their face and determine what is it that I can do for them that will match what they're seeing. And that's where this really comes in. Like I was saying, doing this, that. Sometimes they'll come in, I feel tired, and it might be the lower eyelids, or it might be that their brows are drooping and you have to lift them up, or they think that there's too much fullness here and they think they need a blepharoplasty, but they really need a brow lift. This is exactly where the consultation is so important, where you need that assessment and that talk between the surgeon and the patient.
I think I'm going to end it there because otherwise I'm already like, I could ask this and I'm going to just stop myself. Maybe we'll do a part two when some new trends come in.
Yeah, sure.
But
But
thank you.
on the
Yeah.
trends, I want to leave you also with,
Yeah.
you have to be careful with trends. I personally do not jump on trends. When anything comes out like exosomes, PDR, and all that, I wait a few years because I've seen too many trends do this and then plummet. You never really know, like you said before, what something is going to turn out to be. You see medications and all this. All of a sudden, it's the best thing, and now all of a sudden, call this number if you've been hurt by this. So, trends I think are dangerous, especially when it comes to the face. You can look into them, you can follow them. I mean, someone's got to be the person to experiment on. Just will not
Don't let it be
experiment on
you.
my
Yeah.
patients.
Yeah.
I want to have a lot more control of what I can do for my patients.
I think that's a perfect way to end. Thank you so much. We will, of course, link out to all of your info. And anybody who's looking for some face work, head over to Florida. Dr. Ruslan.
Uh,
Thank
Thank you for
you.
having me.